Hi, I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and we just finished a video for our new patients or people who just want to see what nutrition response testing is about. But in addition to that, we're going to answer some commonly asked questions about nutrition response testing and what we do here at Sheehan Natural Health Improvement Center. And right now, we're going to have two videos. So make sure on this part, so make sure that you watch both of them. Okay, and if I don't answer all your questions, please write them down here in the comments section underneath the video, or call our office and ask us to make a video. I would love to do that. So, one question that we get asked is, why don't you take lab tests? We do take lab tests, okay? It's just that when you take lab tests may show, they give you information about a person, just like you would get in taking an initial history or orthopedic or neurological findings, but they don't tell you what is wrong, okay? I will give you an example. We have a person come in from anemia, okay? Let's say they're anemic, okay? Most people don't know this, okay? But the anemia can be caused by a number of different deficiencies. It can be caused by iron deficiency, hydrochloric acid deficiency, vitamin C deficiency, B9 deficiency, B12 deficiency, amongst other things, okay? Lab testing will not show that to you properly, okay? Muscle testing will. If someone when I had Lyme disease, okay, and I got my lab test back, okay, and I didn't get better when I took the antibiotics and the properly prescribed supplements, okay, the reason why is I had some other issues that was keeping the Lyme disease in place. Lab tests would not show, okay? We are getting better and better in lab tests, and as we do, I may incorporate more. Well, I will incorporate more and more. I still do, but we use lab tests as more of an adjunct as part of the patient history. So understand, I'm not anti-lab test, but most people don't understand that lab tests are only part of the history. They don't show you everything. So that's one. Number two, will I have to take supplements forever? The question of the day. Okay, so why do we need to take supplements? Because most of what we're deficient in is not found in proper amounts in food today because of so-called modern farming, okay? A cup of spinach from 1945, okay, if you took the amount of iron in that, you'd have to eat 45 cups of spinach today to get the equivalent amount of iron. So who's hungry? Okay, because you're going to be eating a lot to try to make up these nutrient deficiencies. Or we can just take some supplements. That being said, you always start with diet and then you supplement that. You cannot out-supplement a bad diet. So we always start with diet. In fact, if people are not willing to write down and bring into me what they eat, exactly what they eat, honestly, I won't accept them as patient, because you have to start with diet. But supplements make up that deficiency very, very quickly, okay? Number three, when can I go back to eating, quote, normal? Well, that's also a trick question. If by normal you mean things that we always ate, you can eat normal right now. But if you mean eating normal as in like eating sugar, processed grains, pasteurized dairy, toxins, non-organic foods and stuff like that, you have to ask yourself whether this is actually food or more like poison. If it's more like poison, I would tell you don't eat it, okay? So when can I go back to eating normal? Just reframe on what you think normal, how would you say this? Reframe on what normal is, and normal is not what the food companies tell us. It's what we always ate up until about 100 years ago. So remember that. Sugar is more of a poison. Processed grains they just turn into sugar in your body. They're like a poison. Okay, pasteurized dairy was, as far as I know, we never had pasteurization until the last 150 years. By the way, that does not mean that pasteurization didn't help back then. It did, but it was for some other problems. How long will it take? Well, the question that you have to ask, or you have to answer with this is, how long has a person been ill? When was the last time they felt better? How severe is it? What kind of genetics do they have? And what are some other things? And just how bad is it today? Everybody is different. Like I said, when I had Lyme disease and I had like a chronically beat up immune system from some of my earliest memories were of terrible ear infections, It took me a number of years to really strengthen that immune system and then detoxify. Whereas someone else comes in, I had a guy come in last year, and he had some digestive issues. I looked at his diet was really good. I said, have you ever had any problems before? No. And he was better in like 2 days. So for those types of people, short term, they'll get better quickly. Long term, it takes a lot longer, okay? The good news is that once people start eating right and get on the right supplement program, they usually start feeling better pretty quickly, within a week or two or something like that. Now, they might not feel 100%, but if someone's been sick for a long time, any improvement they will take, and at least they know that they're on the right track. I have patients that come into my office and they are severely ill for a long time, and they will be like, at least I know I'm on the right track. That's important. Number 5. What do I do if I'm not in the Lancaster area? Okay, we have a lot of people that are in underserved areas that are, I have people that come from 2 hours away, 3 hours away, 4 hours away, stuff like that, and they come here just to see me in my office here. Well, there's a couple different things that we can do if you're not in the Lancaster area. What you can do is you can call into my office and ask for a referral. You can do that. I can find you a referral for someone close to you. If you really want to see me, what you can do is you can call in and you can talk to me personally, and I can try to figure out something on how we can actually take care of your body from afar. Or what would be even better is if you can make one visit down here so that we can actually do a proper assessment. I can meet you, I can figure out exactly what you need, and then do phone consults. So that's how we handle it from afar. Okay? One of those 3 things. So let's stop here. In our next video, we're going to go over the next 5 commonly asked questions. And if you have it, like I said, if you have any more questions that aren't answered here, please write them below, and I will be happy to answer them for you.